Our clinic is unique because it is the first freestanding breast care clinic in the United States. We do only breast care at that office, including mammography, ultrasound, MRI, core biopsies, and genetic counseling. As a leader in technology, we are always looking for the best and newest technology. Our entire breast center does tomosynthesis. We offer it to all our patients. We are one of the first people to offer that. And we are always looking for new things. The doctors really try hard to find the best technology.
Being on the cutting edge of technology and always bringing in new technology, the doctors have to have a way to be able to read the images that we have and have a workflow that's efficient for them to get through the volume of patients we see. So we have to have a PACS that allows us to bring all those modalities and all those images in and allow the doctors to do the work that they need to do as quickly and efficiently as possible. At our clinic, the radiologists all have their own workstations. And at that workstation, they can pull up their mammograms, their ultrasounds, their MRIs. They don't have to get up, they don't have to go to another room, and they are able to efficiently move through all the exams that they need to read through the day right at their own workstation.
We really appreciate Sectra. They're always on the cutting edge of technology. When we first started with tomosynthesis, Sectra was the first one to learn how to display the images, and they were right there with us, figuring out the technology with us, so the doctors would be able to read it off their own workstations rather than a proprietary workstation. They're always helping us with workflow. We've done quite a few integrations with our wrists and with our dictation system, so we can do just about everything from the PACS workstation, and the doctors don't have to look in different places. They're able to just look at their Sectra PACS, get to the information that they want to get to by a click of a button because of the integration that we've done with Sectra. We came up with the idea at our office that we wanted a way for our wrist to launch from the Sectra PACS. So we just went to Sectra with the idea and said, this is what we want to do. Can you help us? And they were able to figure out a way between them and our wrist programmer to come up with a workflow and a program that the doctors would just have to click on a button and it would launch our wrists, and they would be able to have access to that information as well, all from their PACS workstation on the same screen. We have looked at other PACS vendors, and every time we come back to Sectra, Sectra is the only one that seems to be able to support our double read workflow, and they really have everything we need. Anytime that we feel like there's something missing, we let Sectra know. They will put in a change proposal, and they can make it work. And even the things that we might be a separate project, they find a way to give us everything we need within our PACS.
When you have a single workstation, a PACS workstation, it really simplifies your workflow, and it really allows more flexibility and efficiency for everybody, the radiologist, but everybody using the PACS. Hanging protocols are really important. When the doctor sits down to read, you want them to just be able to pull up the case. You don't want them to have to fool around with trying to make sure all the images are hanging or that they're not hanging correctly. You want the right protocol displaying with the correct priors. And so that's a really important consideration with a PACS or even a workstation because you want that to happen in the background so when the doctors sit down to read, they can just read.
Some of the things that the doctors or the radiologists like the best about the Sectra PACS is the fact that they can do a lot from just a click of a button. We have programmed mice for them. They can order their extra views, order put their annotations on images. They make it very easy for them to use the PACS and to communicate with our technologists. We found a way to not have to have separate lists. The doctors can read from one list and still do double reading from one list, which was something that we didn't find in other PACS vendors. And the doctors enjoy the PACS. They don't have a problem using it. They're able to navigate well through it. There isn't a lot of training that they need to learn the tools that they need to get through their workflow. Sectra offers us yearly upgrades where they offer new functionalities, new features. They're always improving. The doctors have new, quicker ways to improve their workflow with the capability that Sectra offers. They've come up with some new ways to read Tomo, to scroll through Tomos or do Cine Loop, and it always makes the doctor's job a little bit easier and more efficient. Some of the things that other facilities should think about are the hardware that they're going to need to support it, the network, the bandwidth. Those are all things that are important in obtaining a PACS, and especially with breast imaging, the images can be pretty large, especially with Tomo now. So those are things that are important to think about when you're buying a new PACS. Sectra really is always trying to be ahead of the game. So with Tomo, they were ahead of the game, trying to make sure that they were able to display, scroll through, offer their customers, let them know what hardware they might need in order to read the Tomos. They always want to be ahead so that they know what their customer is going to need, rather than the customer having to come to them after the fact and say, we have a problem here, we're not able to do this or that. They're ahead of the game, and they're letting the customer know what they're going to need.